Hello everyone, and welcome. I'm excited to kick off our presentation with episode 12. Today, we'll be exploring some fascinating topics that I think you'll find really engaging. We'll start with an overview of what this episode covers, so you know what's coming up. We'll touch on the main ideas, and I promise to keep it brief but informative. So let's get started and dive right in. When discussing the upcoming cardiac catheterization with my 64-year-old patient who has a history of hypertension and angina, I want to make sure he understands the main purpose of the procedure. The key point here is that the primary goal is to determine the existence of coronary heart disease, or CHD. This helps us confirm whether the patient's symptoms are caused by blockages or narrowing in the coronary arteries. While visualizing the disease process, measuring the pressure in the heart chambers, or assessing oxygen content are important aspects of cardiac evaluation. They are more specific procedures done during or after the main diagnostic purpose. So, I'd explain to my patient that the main reason for this procedure is to find out if he has CHD, which could be causing his angina and other symptoms. This information is crucial for planning the next steps in his treatment and management. Remember, our overall goal is to accurately diagnose and effectively treat his condition, and understanding the primary purpose helps set the right expectations for this important diagnostic step. To visualize the disease process in the coronary arteries, we need to understand how atherosclerosis develops over time. This slide highlights the importance of seeing the changes at a microscopic level, which helps us better grasp how blockages form and progress. When we look at the arteries, we're really trying to see the buildup of fatty deposits, or plaques, that narrow the vessel lumen. These plaques can rupture or cause further clot formation, leading to heart attacks. By visualizing these processes, we can identify early signs of disease, understand the progression, and develop targeted interventions. Ultimately, this helps us connect the dots between what we see in imaging and the clinical symptoms our patients experience. The primary purpose of cardiac catheterization, especially in a patient with a long history of hypertension and angina, is to identify and visualize any blockages or narrowing in the coronary arteries. This is a crucial step because these blockages can significantly impact blood flow to the heart muscle. To do this, we use a contrast dye that's injected into the arteries, and then we take real-time X-ray images using fluoroscopy, which is called coronary angiography. This process allows us to see exactly where the issues are, helping us plan the most effective treatment. Understanding the condition of the coronary arteries is essential in managing chest pain and preventing more serious events like a heart attack. So, in short, cardiac catheterization helps us get a clear picture of what's happening inside the coronary vessels, guiding us toward the best intervention for the patient. When we're trying to determine if someone has coronary heart disease, or CHD, we usually start with clues from their symptoms, an ECG, and stress tests. These are non-invasive ways to suspect CHD, but to confirm the diagnosis and really understand how extensive the disease is, we rely on catheterization, which provides detailed imaging and measurement. Now, regarding obtaining heart chamber pressures, this is something we can do with catheterization, but it's generally a secondary goal. We usually do this when we're evaluating valve problems or heart failure, where understanding pressures can influence our treatment approach. As for measuring oxygen content in different heart chambers, that's mostly reserved for specific congenital heart defects or shunt studies. It's not something we typically focus on when diagnosing or managing angina or CHD in general. So why not use these other measurements more routinely? Well, because they aren't always necessary for the primary diagnosis or treatment planning in most cases of CHD or angina. They're more specialized tools used in particular circumstances. This helps us stay efficient and focused on what's most clinically relevant for each patient. Now, let's talk about how cardiac catheterization plays a crucial role in diagnosing and planning treatment for heart issues. This procedure allows doctors to see inside the coronary arteries directly, helping them identify any blockages or narrowing. Once they have that clear picture, they can decide on the best treatment approach, whether it's angioplasty to open the artery, placing a stent to keep it open, or perhaps recommending surgery if needed. As nurses, it's important to provide thorough pre-procedure teaching. We want our patients to understand that this test is key to guiding effective treatment and improving their heart health. Explaining what they can expect, addressing any fears, and answering questions will help them feel more prepared and comfortable. Remember, clear communication and reassurance are essential in helping patients cooperate and feel confident about their care.